Most of the sensory information that is vital to the development of a child comes through the senses of vision and hearing. Vision helps in the acquisition of 80% of our learning. Hence, deficiency in vision has a major impact on learning. An unexpressed visual complaint in a child often results in poor academic performance. Now, I will give you simple checklist that can help to identify vision problem in children by appearance and by visual behavior. By appearance, eye shapes or wander randomly. Pupils of the eyes are excessively large or small. Pupils of the eyes are not black, they appear to have a cloudy film on them. Eyes do not appear to be evenly lined up, they cross or turn outward. Red, watery or puffy eyelids. Lack of melanin pigmentation in the skin. Now we will see the behavior of the child. Rubs eyes frequently, turns or tilts head when looking at detail, covers or closes an eye when looking at details, avoid close work or become tired after close work, reads at close distance, difficulty in reading and writing in dim illumination, complaints of tired eyes, squint eyes, sits very close to the blackboard, prefers to copy from neighbor rather than from the blackboard, has difficulty in walking and running, short visual concentration and attention span, clumsy movements, falls or bumps into things, unable to locate and pick up dropped objects, avoid drawing, cutting, doing puzzles or other visual tasks, complaints of double or blurred vision, difficulty in color matching and identification, difficulty with walking on stairs or curbs, prolonged difficulty in seeing when moving from light to dark, sudden pain in one or both eyes, sudden appearance of floaters, difficulty in reading print papers broken or distorted, avoid playing outdoors, squeezes eyes in a bright sunlight. The goal of comprehensive eye examination is to evaluate the functional status of the eyes and visual system. Thus, provides appropriate intervention to improve the patient's visual functioning. The comprehensive ocular examination encompasses components such as measurement of visual acuity. Measurement of visual acuity is one component of the evaluation that quantifies the degree of high contrast vision loss and in many cases clearly identifies the patient's visual impairment as it relates to the chief complaint. Distance visual acuity is measured through appropriate vision charts such as Snellen and Bailey-Lowy charts at a testing distance starting from 6 meters onwards. Visual acuity of 6 by 6 is considered normal, less than 6 by 18 is considered as low vision and 6 by 60 is considered as blind. Near vision is measured at a reading distance of 30 to 40 centimeter. For measuring visual acuity at near acuity charts such as single letters, isolated words or can be used. Testing distances should be measured and recorded. Ability to read newspapers letter size, that is font Ni, is considered as a normal and difficulty in other levels are considered as impaired vision. Refractive correction. Refraction ensures optimal correction for the best visual acuity and determines the amount of magnification needed for certain tasks. The findings of subjective and subjective reaction determines the need for spectacle correction and low vision devices. Ocular health assessment. A thorough assessment of the health of the eyes and associated structures is an integral component of the comprehensive examination. The components of ocular health assessment may include external examination such as examining lids, conjunctiva, cornea, iris, lens and pupillary response. Biomicroscopy includes lids, lasers, conjunctiva, tear film, cornea and anterior chambers, iris and lens. The tonometry is used to test central and peripheral fundus examination with dilation. Supplemental testing. Additional testing may be indicated by the presence of a specific disease or condition, a patient's complaint or educational or work-related needs. Such testing may be needed, including contrast sensitivity test, glare testing and color vision testing. Contrast sensitivity testing means it defines the threshold between the visible and invisible. Reduced contrast sensitivity can affect reading ability. The most widely used device to test contrast sensitivity is Belly-Robson contrast sensitivity test. Glare testing. Glare testing can be done with commercially available instruments or by environmental stress testing to assess qualitatively the effects of the disabling glare and to indicate the need for special filters. Color vision testing. Color vision anomalies which can significantly affect educational, vocational, daily living and mobility needs can be diagnostic of specific diseases. Some color vision tests can help assess the functional implication of color vision loss. While the clinical measures of vision is useful in planning medical intervention, measurement of functional vision is important to plan management strategies. The usable vision of individuals with visual impairment is referred to the functional vision. Functional vision is the vision available to provide individuals with an opportunity to identify, interpret, understand and interact with their environment. Functional vision can be a minimal as light perception. The functional use of vision depends on many factors in addition to the medical cause of impairment. Assessment of functional vision, termed as functional vision assessment of or FVA, helps us to identify a person's present level of visual performance and highlight the functional implications of the particular vision loss. FVA provides details about requirements for control of lighting and glare factors, preferred field of view and best gaze postures, that is eccentric viewing, advantages of positioning of materials to maximize field of view and postural comfort, adaptations for reading and writing materials such as print size, use of color, fatigue factors, time adjustment and adjustment modifications, use of alternative learning medias such as whether the child needs print, braille, raised line representation and oral media, use of optical devices and for near and distance viewing, use of non-optical devices for low vision devices such as bold ruled notebooks and reading stands. Now, I am going to discuss about the major functional areas that must be assessed. Near vision. It is the ability to use vision for near point tasks such as reading and writing. Near vision is functionally more important than distance vision in the life of young child. Distance vision. It is the ability to use vision to perform distance task functions beyond 3 feet such as board work, orientation, mobility and to recognize faces and to avoid objects. Peripheral visual field. Peripheral vision is the ability to see movement or objects outside the immediate line of vision. A normal visual field is 180 degree from left to right. Color perception. Color perception is the ability to perceive difference in colors. Light sensitivity. Light sensitivity is a condition where eyes are overly sensitive to light, possibly causing pain, tearing and discomfort. Contrast. Contrast sensitivity is the visual ability to see objects that may not be outlined clearly or that do not stand out from the background. Mobility. It is the ability to move from one place to other independently, safely and gracefully. Parents' involvement in assessment. Parents are primary caregivers, are the most knowledgeable persons about the child's functional abilities. Parents facilitated activities may yield more positive results than the same activity done by the unfamiliar person. Their involvement also ensures the importance of working together as a team on behalf of the child. It takes time to learn about the child's functional vision. The optimal functional vision assessment occurs over several sessions and possibly involves more than one environment. This is particularly relevant for the child who has cortical visual impairment and or is multi-disabled. Each child has a unique learning style. Care must be taken to learn as much as possible about individual preferences for types and sequences of sensory information. Motivating materials and interactions, phasing and cueing needs, general temperament and level of mastery motivation is also essential for functional vision assessment. Medical and general developmental information should be gathered to develop a detailed picture of the child to global sensory and for the learning needs. Medical information that includes the diagnosis of the visual impairment, the age of onset, suggested medical treatment and the overall prognosis of the diagnostic stability and of the visual potential. The type of visual disorder will provide an insight what the possible functional vision implication might be. Other health or medical concerns such as seizures, confirmation of the presence or absence of a hearing loss and feeding complications will be valuable information to the assessment processes. Developmental information. Knowing the development level of the child, skills will be provided to information to plan activities that will help us to plan further activities. The child's age will often provide usable information as to the possible development range. Assessment tools and materials. The selection of a functional vision assessment protocol is typically tied to the personal preference of the person using the tool. The testing materials will be vary depending on the developmental and chronological age of the child. With some ingenuity, it is possible to use materials that are considered as age appropriate, while still maintaining a specific skill being probed. Familiar versus unfamiliar settings. Many children demonstrate different personality characteristics and even abilities between environments that are familiar or unfamiliar. Hence, as possible, the child should be observed in both the environment for a realistic portrayal for functional vision skills. Environmental control factors. The ability to control the amount, the type and the position of lighting should be considered. In addition, possible background, auditory and visual distractions should be eliminated to allow for optimal success of the child's performance. Establishing rapport. Before physically interacting with the child, time should be allowed to establish a baseline relationship. The play-based style of assessment is designed so that the evaluator follows the child's lead. As a child demonstrates an interest in an object, the evaluator can ease into the interaction using the object of interest as means of introduction. Type of simulation utilized. The choices for visual targets or simulation presentation styles are different for children who have different causes of visual impairment. Bright colors, visual complexity and novelty are typically recommended as key characteristics of the visual stimuli for children who have an ocular impairment. It is best to begin with one type of visual information and gradually adds more input. Importance of positioning. Careful attention to the child's physical positioning will increase visual performance. Wait time. The amount of wait time between trials must be balanced with the child's need for prompt. Wait time could be decreased as a child learns to practice response. Response patterns. Important information can be gathered by observing what senses are used first when a child interacts with a new object. Vision may or may not be the first sense to be engaged. Many children have a distinct pattern of sensory exploration. This is all a part of the unique learning style of each child. Awareness and attention to objects. The reason for assessment. Can a person see objects close to them? Does the person search for objects visually or with their hands? What makes objects easier or possible to see? Factors that affects how easy an object is to find or recognize are the size of the object and the distance of the objects, contrast and the familiarity of the objects. Control of eye movement, that is called as a skill of tracking. Whether the child is able to follow moving objects with eyes or head movements. The reason for assessment: can the person follow the movement of objects without losing where they have gone? Different directions of the movement should be tested: the up and down, side to side, diagonal and near to far. Control of eye movements. The skill is otherwise called as scanning. Scanning means accurately moving eyes from one object to another. The reason for assessment is some people with low vision have to search around for a long time to find objects. Some may find it difficult to change from looking at near objects to looking for something further away. Discrimination of objects: to know whether the child is able to recognize objects from an outline or general shape. The reason for assessment: to learn if a person can discriminate between people and objects, recognize familiar objects or recognize different or similar objects. Objects can be discriminated because of their color, shape, contrast, position or size. For example, different foods in a market. The details within the objects do not have to be seen. A person can see an object and move around it without tripping over or bumping into it. Large and small objects can give clues of how and where to move safely in the environment. Trees or doorways can be helpful in finding where to go. Discrimination of details to identify actions and matching objects. The discrimination of detail to identify an object is more difficult than seeing the object. Features of the object have to be identified. The reason for assessment: most learning occurs from visual awareness and imitation. It is important to know what can be seen and how the environment affects what can be seen. The factors of distance, size, color and contrast are very important. Discrimination of details in pictures, that is, gaining information from pictures. Pictures can be simple, outline or complex. The important features in pictures have to be identified so that the meaning of the picture can be understood. The reason for assessment: pictures give useful information on posters, advertisements or in books. Objects in pictures may be difficult to find out and recognize. Identification of pictures. Pictures are used to give more information and instructions, such as on health education posters. They are easier to recognize if look like the real objects and have a clear outlines. It is sometimes difficult to find out an object pictures when there is a lot of details and many other objects in a picture. Identification and perception of patterns, numbers and words. Matching letters and numbers by the similar or different features of them. This does not require reading, but it is necessary skill for reading. The reason for assessment: to find out if a person can discriminate between similar and different shapes and letters. The results will help in making decisions on whether a person should use normal size print, large print, low vision devices or may need braille. Vision assessment in infants, preschool and school children is important as they play a crucial role in functional areas such as communication, both person to person, group communication and distance communication, and for orientation mobility. Activities and tasks for everyday life ADL and sustained near vision tasks like reading and writing purpose. Vision assessment in infants. Vision assessment in infants helps to find out important information such as possibility to have normal eye contact or how close an adult needs to be seen by the infant. Infants usually copy facial expressions quite clearly and respond in a meaningful way to many expressions. If an infant seems to have problems in recognition of facial features under expression, possibly either the infant does not see the expressions clearly or the cortical analytic function or the connection to memory have not developed. Assessment of toddlers. As soon as child develops the concept of similar and different, they can be used to train visual acuity test. The test forms in the Lia bustles can first be matched with their cutouts based on their colors, then on their black and white three-dimensional forms, then comparing the forms and pictures of the same size, and finally comparing either the puzzle pieces or the large pictures on the key card to smaller test pictures. Assessment of school children. Before the functional assessment, the clinical examination findings are to be collected from the ophthalmologist as they contain most measurements required for the functional assessment. The visual acuity at distance with a single symbol test and with a line test. Visual acuity at near with a single line and more tightly crowded test. Contrast sensitivity with a low contrast visual acuity test, possibly also with a grating test. Color vision with a quantitative test. Visual field with a confrontation with Goldman perimetry and as a reading field. Visual adaptation to lower luminance levels. Visual acuity test for near and distance, grating acuity test, contrast sensitivity test, visual field test, color vision test, visual adaptation test, test for oculomotor function and accommodation and test for visual perception. Visual acuity test. Visual acuity test to assess measurement of visual acuity. There are three types of tests for testing near visual acuity. In infants and children, visual function at near distances are more important than visual function at greater distance. Therefore, visual acuity should be always be first measured at a near distance through the basic line test acuity, crowded symbols and with single symbols. Visual acuity at near is measured with a line test, which is the basic measurement. In children who are about to learn to read, the reverse side of the near vision test with more crowded symbols, an idea about the size of the test that the child can handle. Visual acuity measured with single symbols, either using single Lea playing cards or the Lea domain cards, reveals what is the smallest symbol the child can recognize when there is no disturbing visual information around. Distance vision test. Visual acuity for distance vision is measured with a test held at 3 meters distance. If the distance is too great for a young child, testing can be performed at 2-meter distance. Grating acuity test. In infants and young children at early developmental level, visual acuity cannot be measured with optotype test because of communication difficulties. In such a situation, the Lea gratings is an easy test to assess to find grating acuity. This test has proven useful in testing vision of children who have brain damage. Contrast sensitivity test. Visual information at low contrast is especially important in visual communication. It is important to remember that visual acuity as such does not define the quality of form of vision. Children and adult persons with equal visual acuity at high contrast may have either normal, slightly lower or very poor function at low contrast levels. Visual field test. Visual field measurements are of two basic types: measurement of extent of the visual field and assessment of the quality of the central visual field. Measurement of the extent of the visual field is done with confrontation technique using finger movements. Color vision test. Since disorders affects color vision in an irregular way, it is important to measure color perception using test stimuli with different sizes. The large color surface can be reduced to the standard size stimulus by using the gray circles included with the test. The panel of 16 color vision test is similar to the well-known Frankfurt panel D15 test. When testing very young children, use two sets of the color caps. Visual adaptation test. Children with a delay in cone adaptation have difficulties in finding objects where the illumination level is lower than in the surroundings. Oculomotor functions and accommodations. Accommodation is a motor function. Accommodation may be poor in visually impaired children and children with other motor disorders, especially with children with cerebral palsy. In infants and young children, accommodation can be measured only by using objective technique of dynamic retinoscopy. Speed of accommodation is easy to measure and important when comparing the use of dominant versus amblyophic eye. The child is asked to look at a symbol on the line just above the threshold on the distance test and not to answer by saying but by pointing to the same symbol on the near vision card, again on a line just above the threshold. The way the child is gently forced to accurately changes focus from the distance to near and back in order to be able to point out on the right symbol on the near card. Visual perception test. In the primary analysis of visual information, there can be deficiencies limited to visual function either in the pathways of the temporal lobe, the ventral stream, or in the visual associative cortex. It affects eye-hand coordination and perception of the egocentric space. Some of these changes in visual form perception can be tested also in children. Leah's rectangle games, the mailbox game, the Heidi expressions are the tools to measure visual perception in children. I hope now you have understood various procedures to identify the children with vision problem and how to assess through clinical and functional vision with the help of different tests. Thank you all.